We get the opportunity to talk to the patients and decide whether it's something that a physician needs to deal with or something that we can help them with. So yeah, we're usually that first kind of line of support. We have done multiple mass clinics, gone out to adult family homes, gone to nursing homes. My son has gone out and worked with the police department and the fire department and helped vaccinate the homeless, and continued to have appointments at the store every day for folks that wanted to get vaccines. I've lived in the area now for a number of years and have developed a relationship with the people, the leadership, and it's home to me, and I want to be able to protect where I live and to keep people as healthy as possible.